Group 8 is an organization working with the aim to increase measles vaccination rates among the children living in Staten Island. Measles is a highly contagious disease that causes fever and rash. Anyone who has never had measles and has never been vaccinated is at risk. Children can be protected by being up to date with their vaccinations. The first dose of MMR vaccine is recommended when they are 12 to 15 months old, following with a second dose at about 5 years of age. We have 3 objectives for this project aimed to be completed by the end of 2016. The first is that we will have achieved a 90% vaccination rate amongst children 35 months and under living in Staten Island. Secondly, 75% of parents will be able to list at least 3 benefits of vaccination. Lastly, 75% of pediatricians and OBGYNs will be able to list at least 3 benefits of vaccination. Our inputs for this project include undergrad and grad students from the University of Saskatchewan and Columbia University, local pediatricians and OBGYNs, 4 full-time hired staff, and a health record database to keep track of vaccinations. The time for this project is expected to range from January 2014 to December 2016 for a time period of 3 years. We will partner with Columbia University, University of Saskatchewan, and the CDC. Funding will come from Health Canada and the CDC. Our budget for this project is $502,643.99. Outputs include information sessions for pediatricians and OBGYNs, brochures and reminder letters, and phone calls. For outcomes, we have 4 short-term goals. To increase awareness, knowledge, and positive attitudes from expecting parents, and to increase support from healthcare workers. Our long-term goal is a 90% vaccination rate amongst children 35 months and under in Staten Island. To evaluate this project, we will look back to ensure that our inputs were effectively applied, that our outputs were achieved, and that the outcomes were successful. To sustain this project past the 3-year mark, we aim to gain funding and support from the New York State Department of Health, the Vaccines for Children program, and the CDC. With the success of our project, we hope to make New York the healthiest state and to influence other large cities into adopting similar health promotion campaigns.